Hi, and welcome to East Cobb Oral Surgery. We recently merged my practice with Dr. Robert Lazarson's practice. We felt like it was time for our two practices to merge together to provide better care for our patients.
I really like the challenge of coming in and having something very interesting to do. I really love what I'm doing.
We're able to have coverage 5 days a week to provide a greater opportunity of care for our patients and for our referring docs.
I think what I love most about the profession is our ability to help people in stress, especially when they're in pain, and we can relieve this pain that they have.
We offer nitrous oxide or even just local anesthetic for procedures that need to be done.
We also offer the ability to have a IV sedation technique given where the patient basically is asleep while we perform the procedure.
Our patients have a variety of different anesthetic options when they're in the office to make their procedures here much more comfortable.
During the initial consultation, we make an effort to really screen the mouth.
This office is very aggressive in its oral cancer screening. This Velscope machine is non-invasive. It only takes just a few minutes to do the examination, and it allows for early detection of oral cancers, which means early treatment.
Our philosophy in the office is that each patient should get as much personal attention as possible, and I think that begins with the patient entering the reception area and being greeted by our staff.
When you come to East Cobb Oral Surgery and you're scheduled to see Dr. Bruner for a procedure, that's the person that's going to see you for the consultation, and that's the person that's going to do your surgery.
For many years, we as oral surgeons did a lot of what we call exodontics, or removal of teeth. But now I think with the advent of the subspecialty of placing implants, I think now we're able to reconstruct people's mouths in a way that we never could before.
The training that I received and the education that I received allows me to have a better understanding of how the body works as a whole. We recognize the fact that the teeth and the conditions in the mouth are not isolated from the rest of the body, but in fact, a lot of times disease processes start in the mouth when they are a systemic problem. So having a medical background, a medical understanding helps me in diagnosing, treatment, and surgical skills with my patients.
I've been doing oral surgery since 1971, and I wake up each day, I get energized, I come into work, I really look forward to coming in, working with the staff, with Dr. Bruner, seeing the patients, trying to make patients' life a little better by either removing their pain or reconstructing their mouth.
I tell patients often, and I tell people outside of the office, that I am so blessed to be able to enjoy what I do and do what I enjoy. I can't imagine doing anything else than what I currently do. I love the opportunities that I have to deal with a variety of patients that come in, and so I get to develop great relationships with people. But also all of the procedures are different, so there's that challenge in everything that I do, which motivates me to achieve even more and to do better the next time. It just gives me great satisfaction to know that I can change and impact people's lives for the better on a daily basis.